Hi everyone, welcome back to my YouTube channel, The Breast Cancer Physio. I'm your host, Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. If you have been impacted by a diagnosis of breast cancer and you want to do as many positive, proactive things towards reclaiming your mental, physical and emotional health, then you've come to the right place. In this video today, I'm going to be talking to you about the signs and symptoms of lymphedema. Lymphedema is a nasty side effect of breast cancer treatment when you've had lymph nodes removed or lymph fields in the armpit or the chest wall radiated. If you enjoy this content and you would like to see more, then please give this video a big thumbs up, subscribe to my channel, which is completely free, and leave a comment in the section below because I would love to hear from you and find out what topics around breast cancer you want more information about. So without further ado, let's get into this video, signs and symptoms of lymphedema. Symptom number 1, swelling. Now, a lot of people that present to my clinic come in with the misconception that if they get lymphedema, their arm is going to suddenly be the size of an elephant's trunk, and that is typically not true. When lymphedema starts, we often feel it before we actually see it. And the early signs of lymphedema can be very mild, intermittent, fluctuating swelling. The whole arm doesn't have to swell either. It might just be a patch of swelling. So one of the biggest predictors of lymphedema can be swelling on the inside of the elbow. So if you get any puffiness that you either see or feel, definitely get down to your local physiotherapist or occupational therapist who specializes in treating patients with lymphedema. Another sign of swelling can be indentations that are left from jewelry, clothing, or watches that normally wouldn't occur. So if there's a mark that your watch always leaves that's really standard for you, that may not necessarily be a sign of new swelling, but if all of a sudden you're taking off, rings or bracelets or a t-shirt and you see an indentation that is new, then that's definitely a sign to get checked out. The other sign of swelling can be bony bumps that are disappearing. So if you put your hand in a fist and all of a sudden these noticeable bumps along the knuckles are not clear, that can be a sign of swelling. Similarly, if you are feeling your arm and you can't locate these bony bumps around your wrist or around your elbow, this could be another sign of swelling. So the take-home message with swelling is that often we will feel swelling or feel puffiness before we actually see it. If you see intermittent fluctuating swelling, then definitely go and get it checked out if you're at risk of lymphedema. Symptom number 2, heaviness. When we talk about heaviness, what we mean by this is that the arm may feel literally heavy to hold by your side. When someone comes along and gives you a dead arm punch, that's the sort of feeling we're trying to describe here. So like the limb weighs a lot more than it usually does. So if the arm feels swollen or looks swollen and it feels heavy, then definitely get this checked out. Symptom number 3, tightness. What we mean by the symptom of tightness is almost like the skin around the arm is too tight for the arm itself. So if there's a feeling of tension through the whole run of the arm, definitely a reason to go and get an assessment of whether or not this is lymphedema starting. The interesting thing about these symptoms is that sometimes multiple symptoms present and sometimes one symptom presents. But the most important take-home message that I'll talk about a little bit later in this video is to get checked out early. I'll go into this a little bit later in the video as to why that's so important. Symptom number 4 is pins and needles. Now, this is not the most common side effect that I typically see when I'm diagnosing someone with lymphedema, but it does happen every now and again. The tingling, I would describe it as a light tingling through the limb, so it wouldn't be in a certain area, more so just a light tingling through the length of the limb. There may be other practitioners that have experienced slightly different presentations of pins and needles, but that's classically what I've seen in the past. The other thing to note about pins and needles is that we're not talking about a common side effect of chemotherapy, which is called peripheral neuropathy. Peripheral neuropathy classically happens in the tips of the fingers or the toes, and it usually happens on both sides of the body. Most of the time when people get lymphedema, they're experiencing it on one arm or one leg. people are very unlucky if they're getting lymphedema starting in both upper limbs at the same time. So if you've got tingling just in your fingertips, then it's on both sides, then it's most likely peripheral neuropathy if you're going through chemotherapy. But again, if you're unsure, please get down to your local physiotherapist who specializes in lymphedema, and they can help diagnose this with you. Symptom number 5, ache. Now, when we talk about an ache, we're specifically not talking about a really nasty, severe ache. There's been very few patients that I've seen who have significant pain with lymphedema. I'm sure it does occur from time to time, but typically the ache is more like a dull ache, sort of like a background toothache type pain rather than something really severe. If you did have severe pain and you had swelling, we would probably be suspecting something other than lymphedema, and that sort of a pain would usually warrant investigation on another level, so a CT scan, a Doppler ultrasound, or something else to check for another pathology. So if you've got a dull ache in the arm and you've got any other signs or symptoms like swelling, heaviness, tightness, pins and needles, definitely get down to your local physiotherapist and get a diagnosis. One of the most important take-home messages from this video is the fact that if you have any suspicions that you have got signs and symptoms of early lymphedema, is get it checked out at the earliest point possible. This will give you the best opportunity to stop this disease state progressing to a more advanced condition. So the most important take-home message from this video is that if you do have any suspicion that you've got signs or symptoms of early onset lymphedema after breast cancer treatment, then get down to your local physiotherapist or occupational therapist who specializes in lymphedema. The most important thing you can do is get early intervention on the beginnings of lymphedema. If we don't intervene at the earliest possible stage with lymphedema, often it can progress to a more advanced state of the disease. So this is where you do see people who have increased swelling, so really large limbs that are misshapen. They have to wear compression sleeves constantly, which is a huge burden to them, physically, emotionally, and psychologically. Compression garments are also really expensive for a lot of people, so the best thing you can do to avoid lymphedema progressing to a worse state is to act on it as soon as possible. The other really exciting take-home message from this video is that if you do get diagnosed with early onset lymphedema, there's a lot of cases now that are being reversed. Yes, you heard me correctly. There is the possibility to actually reverse your lymphedema, but it does have to be caught at an early stage. If lymphedema progresses beyond an early stage, the chances of reversing it are a lot more difficult. However, the other positive news is that if you get lymphedema and you get it diagnosed early, but we can't reverse it, if you get lymphedema treated in an earlier phase, it'll be more manageable down the track. So what I mean by this is if you have been diagnosed with lymphedema, it hasn't been able to be reversed, the most likely outcome is that it's going to be very manageable lymphedema because you're on top of it as soon as possible. So don't leave it, don't delay, get down to your local physiotherapist or occupational therapist, get them to do a thorough diagnosis as to whether or not you do have lymphedema, and then you can start to intervene as early as possible, which is going to give you the best possible chance of managing the condition or at best reversing the condition. Thank you so much for watching this video. I hope you found this information really helpful. If you have any questions around signs and symptoms of lymphedema that you would like answered, then please leave a comment in the section below. I release a new video every week around the topic of breast cancer. I hope you can join me for the next video. Thank you so much for watching. I'm Jen McKenzie, the Breast Cancer Physio. I'll see you next time.